And we have with us Dr. Felix Cabrera. Doc, thank you so much for taking time to do this interview. I know you're extremely busy. So again, thanks so much for joining me. I really wanted to just get right into it because I know you got other things to do. If you could just bring us up to speed with the pending changes to the government quarantine policies as it relates to fully vaccinated individuals. It was mentioned during a press conference held in Adelup, you were there, of course, on April 30th about the proposed traveler quarantine program. And at the time, the goal was to implement it in 2 weeks. So Friday would mark 2 weeks. Where are we with implementation so far that you can actually share with us?
So what I can share is that the governor's been very clear that she very much intends to have it take effect on May 15, which will be this Saturday. And so we're on track to doing that. And so during the press conference, we had a preliminary flow chart that was presented, and that included some of the requirements that were suggested at the time for verification of those who have been fully vaccinated. And those are still very much being reviewed, and those will be announced, the finalized version of it, in short time.
Mm-hmm. And so what would be your response, though, to some who may say, why not also require a negative COVID test result on top of the proof of verification for vaccination, just as an extra layer of security?
So this is what we know, okay? And so based on data that the CDC uses, and in terms of making the recommendations, we look at percent risk reduction, right? If we quarantine everybody, for 30 days straight, the risk reduction is probably going to be 100% if they're in a bubble, right? So that's 100% risk reduction. However, so if all we do is test and we don't care if they're vaccinated or what, and we just do a pre-arrival test, you're only reducing the risk by about 15, anywhere from about 15 to 25%. That's all you're doing is reducing that risk. That's the example what Hawaii does, right? And what the rest of the United States does for international travelers. So you take that. However, doing the quarantine system as we're doing it right now, that's greater than 90% risk reduction. And so that's pretty good. That's why we've had so much success over the past months, ever since the current quarantine system has been in place since September of last year. And so what we know, and with the data that CDC has shared with us, is that if you have somebody who's been fully vaccinated with one of the 3 FDA authorized vaccines in the United States, and if you have proof of that and they've been out of that 2-week window, the risk reduction is around 90% for that. So it's very comparable to quarantine people in general. So that's pretty good. And furthermore, what they showed was that if you try and make someone be vaccinated and have a pre-arrival test, you're actually improving the risk reduction by only about 1.5%. So that's a lot of hassle for a traveler to go through for not that much additional benefit for our protection here on Guam. So we followed the numbers, and that numbers led us to creating the pathway that has been suggested, and the final version will be shared probably in the next day or two.
Right. And, I got to say, when I was off island, I was doing the research on, okay, I've got to get the negative PCR test. So, and it's like $200 just to get that, to get the test to come back home. So, when I realized that May 1, it wasn't going to be reopened. So whether you were fully vaccinated or not, it wasn't going to matter. I just went ahead and just said, okay, well, I guess I don't need the PCR test because I'm going to go straight to quarantine anyway. But yeah, that's something people need to consider. So it's a good thing, I don't want to say it's a good thing, but I can understand, if that was part of the reasoning behind, well, you're not going to need the negative PCR test, because it is quite a chunk of change you're going to have to pay. Even if you are fully vaccinated.
Yeah, and if you think about that number difference in risk reduction, right? So can you imagine if we made that requirement, and then we didn't have the data to back that up as being the smart move, when really the smarter move is to use vaccination status as the one of the key mitigating factor. I want to mention though, one of the greatest risk reduction factors is not what's happening to the traveler. It's again the community that they're entering. So the more of us that's fully vaccinated, the better risk reduction we get. And so I think that that's really, really important. And so that's why I say like greater than 90%, because the more we get vaccinated, closer to 100% we get.
Right.
So that's why it's
yeah. And according to the latest numbers from the JIC last night, I think it's over 71,000, and that's fully immunized individuals on Guam. So having said that, are we, you guys pretty confident that come July 21st, we are going to be achieving herd immunity?
Yeah, so there's so that puts us about 56.8% of those who are 16 and over being fully vaccinated. So that's pretty good. So that's how we're well above 50%, and so that's great. And so in terms of what gets us to full herd immunity, again, that definition might change based on who's eligible, right? Because it's going to be very difficult to, if you say 100% of the community we're counting, and if we're saying that's like, let's say 80% of that, that's going to be extremely difficult. But based on how we set the target early on about those who were 16 and over, because we knew since late last year that what the age groups were, so we used that as our goal for Operation Liberate Guam, and I think we're still very much on that trajectory to achieve that goal of 80% being vaccinated by then. And now with those 12 to 15 becoming eligible, that makes that goal even easier. And so I think, but again, it's again, that's in theory, and so we need to see it in action.
So is that when are we going to see that being implemented locally in terms of expanding the eligibility to 12 to 15-year-olds?
So so as we know that the FDA issued the authorization for 12 to 15 with Pfizer only at this time. So Pfizer is 12 and above, where all the other two, Moderna and Johnson & Johnson, are still 18 and above. Now, but for us to implement it here, we have to have basically the CDC's sign off on it as well. So the vaccine committee for the CDC, they are meeting Wednesday, stateside time, and so so we may get a decision about the okaying the expansion as early as be Friday morning for us. It will be, and so we may get that full okay by then, and so we'll probably be making it effective, immediately, just like how we did, when the Johnson & Johnson came back on where the pause was lifted. And so we'll be seeing that, but we may wait until Saturday, in honesty, to really start doing that. But we know a lot of very responsible adults who are very eager to get their 12-year-old and older vaccinated, and so we're very happy to hear that.
Right, you said possibly Saturday, but these vaccination clinics, a lot of them are during times when parents are working. Some children are in school if they're on face-to-face. So are you guys considering opening these clinics in times where parents can actually go? Because from what I understand, your parent has to be there. You can't just send your child, obviously, to go get a vaccine without your mom and dad there.
Yeah. Your parent or guardian, is the key part there, and of course they have to sign, for them. And that's just like any vaccine that kids have to get, right? And so that's the key part there. And so, as you can see, that the team in particular, the state surgeon cell has been really proactive in partnership with AMC and GRMC, also being very flexible and trying to figure out which ways to accommodate and really get we're getting to a point where now we're gonna have to go out more to people, into industry areas, and even the school-based vaccinations as well. So we're looking at all those as key ways to get the adolescents vaccinated.
Okay. One thing, we had Chima on last week on the link, and he was talking about the pilot program. It launched last week, Friday, where you have these combination, one and done type of COVID clinics where you could go in, get the rapid test. If you're negative, you can get a vaccine. So it was last week, Friday was the first one. Then there was one, I think it was yesterday, at the old Teason Carnival grounds. How's the response been to that?
So Friday, so it rained a lot on Friday. So that was, literally put a damper on that part. But here's the thing, it wasn't necessarily announced. So it was actually just a pilot project just to see if there's proof of concept. And it was very successful in that sense. And Dr. slash Major Luis Cruz, who's leading this effort, was very happy. Even though if you just look at it on paper, the numbers didn't, look good. But then yesterday was even more successful, and we are being able to get some people who did turn out positive, and so they didn't have symptoms, but they were very much wanted to get vaccinated, which is, so it's a good thing that that we can do it in this process and be able to stagger it in that fashion, so we can get the most out of people going out for one trip, right? And so.
So it sounds like it's working, and you plan on doing more of this one and done type. Right. Okay. I wanted to go back into the vaccination verifications. The announcement came out by the Joint Information Center on Monday or Tuesday about how people can start making these appointments, sending emails to public health, and that there were plans to go digital. Dr. Nguyen was talking about a QR code, but that's more so on the private sector side. Can you kind of walk us through the vaccination verification process on public health send?
Yeah, so on the local site here in Guam, so now the very specifics of this will be announced with the travel protocol itself and what you need to do very specifically. But as it is right now, and just plainly stating as it is right now, you have your vaccine card, right? And see, mine's always I can quickly grab it at all times. It's in my notebook. And so I always have it there. And can I just say, one thing that the CDC could have done a whole lot better is make this wallet size or credit card size.
Exactly.
So that's a major fail on the CDC's part, in my opinion. But that being said, if you don't have your card, and so they may not be able to reissue a card, but they can print out a what is your registration in the web IZ, and then that also serves as your verification of that you've been vaccinated. And we can also double verify that if we wanted to on a spot audit, for example, by just logging in and cross-checking the name there. So that's what that process is. Now the vaccine office is at at Castle Mall, and so that's where they are able to do that on request. So the requirements for appointments, I'm not going to go into that detail because I don't know that very well, but theoretically there shouldn't need to be an appointment, because you just show up and say, here's my identification, I know I was vaccinated here, can you give me a printout copy? And so that's what that would be, and it just how that system would flow through will be announced once that's all finalized.
Mm-hmm. Do you know, though, if this vaccination verification printout, is it once you get it, you're good to go if you plan on going off island, or is it every time you leave, you have to get a new printout?
No, it's just the one copy will suffice, and so that's your proof right there, and you can and technically you can make a copy of a copy, so it's because that information is there, and that's really what we care the most about, just so that we can cross-reference, and it will be subject to audit, either immediately or even after the fact. And that's a part here that I think everybody has to remember, that we'll have all these different processes, and people are going to have concerns no matter what about fraud, or people making cards. But in the end, what people really need to be worried about is the penalties that will come if you are caught with a fraudulent proof of vaccination. Because this one we're taking extremely seriously. Same reason why people still don't smoke on airplanes or tamper with the smoke detectors, right? Because there's a big fine with it. It's like $10,000 or something like that. And so in the same sense that people didn't really need to be very cognizant, and especially if you think you're going to go through this fraudulent way. And then in the end, the vaccines are free. It's so much easier to just get vaccinated and keep that proof. So so we really are basically hoping that is the true power in ensuring that people are compliant.
Right. So so again, in terms of that printout, that vaccination verification, there's no expiration date on
No,
it. Right?
yeah.
Okay.
As it is, it's like just like it's the same thing as your card. It's the equivalent to that for here on Guam as being a
Okay. Okay. So whenever this the governor makes the official announcement about the quarantine travel program, that would be also the signal that we are ready to reopen and start accepting more visitors, right? It's all together.
Yeah, it's all together, and and
Okay.
again, as of right now, we're still aiming for May 15. And again, that reason why we was delayed was just because of those clusters from April, and we want to ensure that there wasn't going to be a major spike in hospitalizations or deaths. Now, yes, we did have deaths from last week, and as unfortunate as that is, there is no direct link to any of the clusters
Mhm.
that's known as of now. So these were, and the hospitalizations did go up a tiny bit, relatively speaking, but it didn't go beyond what we felt was a threshold, which was like 10 hospitalized COVID patients on the island.
Mhm.
Remember, our peak was 102 at one point in November. So.
Right. So May 15th, that's what we're looking at with the new quarantine protocols. When you have to have the verification. What about for people who are currently off island and they're fully vaccinated and they're wanting to come back to Guam, but they don't have that printout of the verification? What will happen to them?
So as was what was published as the preliminary, there was a section there for those who, because
Okay,
there's an immediate verification part,
I
and
saw
then
that.
there's a delayed one, and that delayed one may mean that you do have to go to the QFAC, and it may be 24 to 48 hours until that can be confirmed. And it might even be the same day, just that we're not going to hold you up at the airport. We're going to go, you may be able to go to where it can be better verified under different circumstances. So I don't want to commit to that very specifically, because there's going to be so many things, and we're going to pivot when things are not working. And if it seems like there's a big bottleneck for some reason and it's just not working and there's a better way, we're going to pivot to that. And so, it is the safety is number one, and then number two is really the efficiency is what we really need to consider here, because
Right.
and again, who is going to start coming? It's really still going to be mostly stateside travelers coming to Guam, either returning or visiting. And so that's what we're going to primarily be seeing.
GVB, they've been talking about, Uncle Carl, this Air V and V. I think it stands for visit and get vaccinated. I'm not sure, but is that something that you guys are supporting?
Yeah, there's a diverse team that's looking at that right now, and basically it's it's in relation to expats, if you're living abroad, are still of course U.S. citizens, and what might be a way to accommodate persons like them, and but one of the key things, and the key things that Governor LG has made clear is that if any program were to be implemented like that here, is that it can't tap into our current supply of vaccines. And so we would be requesting additional supplies from the federal government to say, hey, these are U.S. citizens that are not residents of Guam, but we are the tip of the spear here in the Western Pacific. And if this program can be set up, then we need the federal government to help support it, and that means giving more vaccines so it can be a successful program. But I don't think we would be looking at a large amount of people, but they would still be subject to to our the travel quarantine process and particular exemptions that may be made, or this program may be a different arm of that. And so all those are still conversations and that are still being considered. But I think it's good.
have you guys, are you guys tracking the numbers in terms of people that have been vaccinated and I guess have tested positive for COVID?
Yeah, we have, and I can share some of
I mean,
those.
is it concerning? I mean,
No, it's not.
mhm.
And I did share a similar slide, I think from, I forget which,
At the press conference.
I don't know if it was that one or the one before that. And the numbers haven't
Mhm.
changed that much since then, where it's still like it was under 10 that have been fully vaccinated and have tested positive. And so that ends up being like a 0.012% of all those who've been vaccinated, turning positive. So
Mhm.
that's pretty good, when you think about that. And so if anything, we're doing better than what what the studies have shown, both in the trials and in the real world in terms of vaccine breakthrough.
Mhm. Anything on variants?
The one is that, again, there is the Indian variant, or the variant that is originated in India, and it has a similar mutation as the California variants that we know about in terms of making them more infectious. The California variant is about 20% or 30% more infectious, and that may be what we're seeing with the Indian variant, but it is something that the WHO is looking more, and is now considering it the equivalent of the CDC's variant of concern. And so I think it'll be short time before that's going to make the CDC's list as a variant of concern, which is on par with the variants that originated in UK, South America, South Africa, and Brazil, for example. And then, which then there's the variants of interest, which are the lower ones that we're interested in that. It seems to be popping up in this areas. We don't know if it's concerned, at this time. And so, it remains to be seen if that's going to be moving into that category. But otherwise, in terms of other results for the sequencing tests that were sent to the CDC, there are no new results since the last time it was shared.
Okay, so just if you could refresh my memory, which variants were I guess are on Guam?
Yeah, so the three from the last one were the UK variants, and
Okay.
so that was one was a traveler from stateside from Arizona specifically, and then two were from the Philippines in these two cases, but they were caught in the quarantine facility, and then they had their full isolation done. So at this point, there is no evidence of any other variants of concern that has been present in the community aside from the California variants that were announced a couple of months ago.
All right. Is there anything else that you wanted to get out to the community before we let you go and get back to work?
Thanks. So I think again, those who have been waiting to be vaccinated because of fears that it's going to take too long or what have you, that fear does not exist at this point, because you can get vaccinated very expediently. I tease my patients here in clinic and say, it took you longer to see me than it will take you to see me today than it will take for you to go through the process of getting vaccinated. And so once they hear that, and then the second thing again is that every day we're getting more and more data about the safety of these vaccines. And so we're incredibly fortunate of how actually safe these vaccines are, and that the risk of getting COVID and getting sick from it or giving it to somebody you love and they get very sick from it is still very much in the favor of, you want the safest part here, it's getting the vaccine. And so we still need more people to come out and get vaccinated, that's for sure. So the last, when we look at the population, again, I just want to give out major kudos to those 16 years to 29-year-olds, because they've been coming out by far the biggest group coming out to get vaccinated. However, they are the biggest group also, and so percentage-wise, they're behind the rest of the other age groups. But numbers-wise, just phone numbers, there's been quite a number of them, and so and they outpace all the other groups, and so that's what's really impressive.
So sorry about that. It's my,
You're-
my dogs are. I'm teleworking. Still
Yeah.
in home quarantine.
But with your work background,
Yeah.
this is not a fake background.
Well, thanks again, Doc, and I guess we'll be staying tuned for any possible announcements coming out of Adelup soon. So
Yeah.
thank you again so much.
Yes, thank you, and I appreciate the community's concern also, and the community's actually being understanding with the delay in this transition in the quarantine. And remember, the default still is to be quarantined at the QFAC, and that still is the default process. The question is, would you qualify for one of these exemptions? So think of it as a bonus, not as a penalty to go to the QFAC. But a bonus if you do get exempted. And that's if you can do all the necessary things. And it's complicated to travel. And so it's going to be complicated to ensure that you prove that you are vaccinated, but you need to be able to do that to qualify. And so we appreciate everyone's understanding.
All right. And I did my time at the government quarantine facility. It wasn't so bad. So
Yeah, good.
I could do it. Anybody can do
Here.
it. Thanks, Doc.
Okay,
See
thanks.
you
Have a
soon.
good day. Okay, take
All
care.
right.
Bye.